there are a couple of trying to get some chairs for those of us standing. But in the meantime, I think we're good to get started. And if our DG comes, hopefully we are able to open this session up with him. So welcome to all of you here today. We've been gathered here to talk about sort of One Health horizons, catalyzing collaborations, looking at policy levers, as well as connections that are needed to avoid our silo effect that's been going on in One Health. We've been talking a lot about One Health. You've been here earlier in the week, and we've been talking about sort of sustainable animal aquatic food systems. How do we synergize? How do we integrate better? And we're really hoping that today's session is going to be looking at a range of presentations as well as an engaging policy discussion with extremely great panelists. We're going to help us unpack some of this stuff. Would have liked to open the session with our Director General. Unfortunately, I think they're tied up with multiple sessions. So I'm going to allow our program lead, Hung Nguyen, to open up the session and say a few welcome remarks. Hung, over to you.
Thank you very much, Ekta, and good morning, everyone here online here in Nairobi. I see that, the people online don't see Ekta, but only me here on the front with our colleague next to here. So I still hope that our DG, Professor Apollinaire Jinkang, DG of International Livestock Research Institute, is coming during the session to welcome you. But to keep the time, and sorry online people, we are really having 10 minutes delay. Apologies for this. So on behalf of INRI, and Apollinaire wouldn't come, I would like to really welcome everyone, our dear colleagues, partners, participants here and online to this One Health session. And I think that is very important topics because One Health is now part of really the new portfolio of CGIAR 2025-2030. And actually, I am here together with David and many other colleagues working for SAF Science Program, Sustainable Animal and Aquatic Food System, in which we have an area of work of One Health we will discuss later, but many other programs in this new portfolio also dealing with One Health. And for that, we will hear more how we work on One Health, not only on livestock and fish, but also on plant health and soil health in this discussion. So with that, I welcome you, and we look forward to the very successful and exciting discussion today. Thank you very much.
Hung, thank you very much, and welcome again. I think I'll let you take the floor because you've got the first presentation to share with us what One Health is, what the CGIAR is doing in One Health. So over to you. Thanks.
Yes. Okay, it's me again, and actually now I switched my hat into someone leading One Health at INRI, but also I led the One Health initiative of CGIAR. And I hope that the slide will come up for our also online people. And I hope that our online participant can hear us when from Nairobi. Great. Okay, in the next 15 minutes or so, I try to summarize a bit the work related to One Health that CGIAR have been working for a few decades. And I have to say that as someone working for International Livestock Research Institute, most of the One Health linked to livestock, but also aquatic food system. Next slide, please. And I'm talking on behalf of our One Health initiative group in CGIAR. Okay, I just put here a slide to show you different development challenges that we are facing during this CGIAR week in Nairobi. We hear a lot and we repeat it all the time. And our ISDC from CGIAR coming up with global challenges that CGIAR have to work on to address these challenges. You can see a few challenges here in terms of population growth, urbanization, demographic shift, high income inequality, climate change, but also natural resource declaration. All these things affecting our life, our ecosystem, and actually affect also the core groups that CGIAR want to address. Next slide, please. And actually, when you move from these global challenges into the food security, health-related issue linked to our mission from CGIAR, when we want to transform food, land, system in the climate crisis, three very major things we have to address at the moment. So the first one is about emerging and infectious and zoonotic diseases. You can see for the last few decades, the frequency of emergence of infectious diseases, in particular zoonotic diseases, increased for the last decades. COVID alone, zoonotic disease, killing more than 7 million people and causing so huge social impact in our life. So we need to address this. Antimicrobial resistance, we use both in livestock and aquatic and even in plant, also killing about 1 million people a year because of the resistance in this area. And the third areas linked to the global challenges in terms of food security and global health about foodborne diseases, food safety. The burden of foodborne diseases is equivalent to HIV/AIDS, malaria, tuberculosis, and it causes a huge loss of more than $100 billion a year. And most of this health and economic burden come from low and middle income countries where CGIAR is focusing. And to address this complex health issue, we need integrated approach. And One Health is actually one of these integrated approach that we use this to address this global issue. Next slide, please. So I believe that many people have heard about that, but I just want to have an idea about our audience in this room and online. You can show up by the hand also. How many people have worked on One Health? Can you raise your hand? Okay, not many, actually about 10 or 15 colleagues. How many people have heard about One Health approach? Obviously, you heard more than that, than practicing. Okay, thank you very much. And I hope that online people, you can show so hand also to see how familiar you are with this global approach of One Health. Okay, I just want to show you here one slide showing the latest definition of One Health set up by the quadripartite organization, One Health High Level Expert Panel, OLEP. So I have the pleasure to be part of this global group working on One Health. And for this definition, they emphasize very much One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, the health of animals, and the health of the ecosystem. So we are not talking about three healths, but we talked about one health, one unique health of people, animal, and the ecosystem. And for this approach, they go really to the mobilization of intersectoral collaboration. Different sectors have to work together to really optimize the health at the interface of people, animal, and the ecosystem. And it shows also the really close interdependence of the health of our people and animal and the ecosystem. Next slide, please. I just want to emphasize that we are sitting here in Nairobi in the beautiful compound of the UN. And when we talked about the quadripartite organization, so they include WHO in Geneva, they have FAO in Rome, but you have also WA, World Organization of Animal Health in Paris, and here UNEP, the headquarters here in the place we are sitting here. So on this discussion on One Health Action Plan was signed in 2021. I'm very happy to have our colleague from WA here sitting here today, but also people from UNEP. And I don't know if you have FAO and WHO people in the room or online, but we recognize that this is a very important framework, and CGIAR want to align our One Health research and One Health implementation with the joint action plan that you can see in the left-hand side of the slide that emphasize very much on zoonotic diseases, food safety, AMR that I mentioned before, but also in how to integrate environment in One Health, building capacity of the government, and strengthening the capacity to address the foodborne diseases risks and so on. Next one, please. Hector, can you take the cone of Apollinaire for me? Maybe he's on the way to come here. And I hope that our DG can come here to welcome us during the session as well. So Apollinaire, I give the phone to Hector so that he can sort out during the overview. Next slide, please. Now, when we talked about One Health at CGIAR, I asked a question. So we are active in this space at CGIAR. Can you push one, Geoffrey? I have to say that first one, I have to say that INRI and WorldFish are nature center to work on One Health because we work on animals. on zoonotic diseases, AMR, and food safety. So we have been active for many years. One click more. After that, IPRI and IMI come in from the environmental perspective, but also from economics analysis of One Health. One click more. And now on the center working on crop, you can click more, one more click here. So, the soil health, plant health coming in. And the last click is about our colleague here sitting close to UNEP here, C4 Ecraft, working on, wildlife, zoonotic disease linked to forestry, and so on. So I have to say that apart from INRI, OneFish, IMI, and IPRI, we have been working many years together on One Health. Now we need to embrace more crop-based centers, crop-based research center to work more on One Health. As the definition now of One Health is not about food safety, zoonosis, AMR, but it's open up on the ecosystem. And for that, plant health, soil health, water health are so important in this discussion of One Health. Next slide, please. It's very timely to show you our latest publication. I think that it was published last month, led by our colleague Stephen Lum, sitting in the room here together with me and some other colleagues at INRI. We try to review the 2 decades of work of One Health at CGIAR. And for that, we collected 24 projects implemented by INRI, with the value minimum $1 million up to $10 million for the last 2 decades, to see, what have we achieved and, what would be the way forward to that. And for this analysis, I don't talk about the success, but the gap and the opportunity is really to really emphasize. And here is the key message. If you forget everything, please retain this message. Our review showing that the need for stronger cross-sectoral collaboration, greater engagement with policymakers to translate research findings into actionable strategies, and the development of adaptable and context-specific interventions. It means that we need to do more to have this One Health work on the ground. And for that, INRI, we developed our own strategy of One Health during the pandemic time. ECTA and One Health Center in Africa contributed a lot on that. And we said that we take livestock as an entry point of One Health, and we work on epidemics and pandemics. We work on epidemic zoonosis. We work on food safety and antimicrobial resistance, focusing on the 3 pillars of the strategy. The first one, we are from research organization. We do a lot of research, generating evidence from technical point of view, but we are moving also on the policy and building the institutional capacity to implement One Health at different levels, global, regional, country, but also the community level to make One Health work. And for that, I mentioned from the beginning that the biggest effort of bringing different CG center to work together is really our One Health initiative of CGIAR that ended last year. It was a quite short cycle of research project, including INRI, OneFish, IPRI, IMI, to work together on this initiative aim to protect human health by improving the detection, prevention, and control of zoonotic diseases, foodborne diseases, and AMR in low and middle income countries. And if you look at the structure of this initiative, you can always see zoonosis, food safety, AMR in the middle, but we added also a layer of environment, working mostly on water, but also economics, governance, and behavior. So you already see the switch within CGIAR, how we embrace environment and its social economics into One Health to address this issue of One Health from food security and food systems. Next slide, please. So we close this projects, and here the key highlights of our initiative is really to advance. We have advanced our understanding on infectious diseases, factors influencing antibiotic resistance in livestock and aquaculture, but also gender consideration in One Health. And we implemented this project in 7 countries. We reflected how to improve the process and our partnership among Center and CGIAR. We published about 100 papers for the last 3 years, and also policy brief, as I can show here. But more importantly, we increasingly play our advocacy work in One Health at different level to advocate for more investment for One Health. Next slide, please. And for example, that is only one project at CGIAR. INRI, we have quite a nice portfolio of project working on One Health. We have a portfolio of about 25 million a year. to work on various aspects of One Health. You can see here that we have One Health Center in Africa funded by BMZ, or capacitating One Health in Eastern and Southern Africa funded by EU OACPS program, working in 11 countries, but many other projects on the ground in different countries. And we have also some projects in Southeast Asia and South Asia, mostly focusing on food safety in Vietnam, or milk quality and One Health implementation in India, and so on. Next slide. So if I summarize in a few words on the outcome of One Health work at CGIAR for the last few decades, I would say that One Health research have strengthening the capacity in the country to control neglected and emerging zoonotic diseases in several countries. And it was very nicely shown during the COVID time how we use One Health approach from animal health research perspective to assist the public health improvement in Kenya, for example. We analyzed a lot of COVID samples. We did a lot of whole genome sequencing, which is a facility we have in INRE and other agricultural research institutions. That is one. The second area is about food safety. So we developed the risk-based approach adapted in developing countries to a holistic One Health diagnosis and intervention in traditional markets for meat, milk, and eggs in these sectors. And finally, we developed and implemented interventions to reduce antimicrobial use and resistance in developing countries. And actually, this is really the few words to summarize the outcome of our One Health work at CGIAR for the last 2 decades. In addition to that, we emphasize on the partnership. Of course, our colleagues from WISE here, WHO, FAO, UNEP, we all work with you to implement One Health at global level. But not about global level. We need to make One Health work at the country level. And for that, we supported many national One Health platforms in Kenya, in Vietnam, in Ethiopia, in Uganda, etc., by developing the capacity to address the One Health governance, how to put people and ministries to work together, but also developing different technical working groups, for example, in food safety, in zoonosis for Vietnam and Ethiopia, and to develop advocacy work for the country also. So this is really a short summary of the outcome for that. Next slide. I just want to tell you here, of course, we work on livestock and aquaculture and agriculture and so on. But wildlife is very important component of One Health. And more and more we need to embrace the environment, the dimension and wildlife into our One Health. And for that, we launched last September at the World One Health Congress in Cape Town a flagship report on eating wild animals, rewards, risks, and recommendation, looking at how we can address the risk of the poor population who consume bush meat in Africa. But in another context, in Southeast Asia, in Vietnam and China, only most of the wealthy people consume wildlife. It comes from wildlife farming. So we need to deal with this. And if you want more information, you can have the report online for that. Another areas I want to highlight, it's really to make One Health work on the ground. We are here, talking at the conference, etc. It's very nice. But most of the One Health issue come from the ground. Zoonotic diseases, food safety, immersion of AMR coming from the field. And actually, we need to work with people in the field to address the problem where it comes from, sorting out the problem closer to the place where the problem emerged. And for that, for example, INRE together with University of Nairobi and Liverpool, we set up the so-called One Health Lab in Kajiado, about 400 kilometers from here, where we are sitting in a county of Kenya next to Tanzania, to really bring people from university, animal health worker, public health worker, but also communities and students to work on zoonotic diseases, sitting as the interface of wildlife, livestock, and the environment and people. You see, that is the pastoral area. So people can samples, having group discussion, processing sample on the ground before sent to the lab in Nairobi or other place for advanced analysis. Or another example in Vietnam, in Thái Nguyên, a northern province in Vietnam, where we developed the One Health field site. The concept is similar, to bring people together to deal with the problem of rabies, food safety in a different production system. There they produce a lot of pigs and chickens, so how to deal with AMR issue, for example. That is really another model to make One Health work on the ground. The last example I would like to show you in terms of One Health research and implementation. Next slide, please, Geoffrey. is really our flagship project in Ethiopia, in Somalia, and Kenya, where we develop the integrated service delivery with the community to improve in the same time providing health services for people, providing vet services for animals, and also the rangeland management, so improving the environment qualities. It's very much integrated. And this evening, that study will be featured in the impact report of CGIAR in the session this evening. Okay, I have a few more slides to go, and I want to go quickly to strengthen the capacity of research in One Health. It's not about research project. We need to train the next generation of One Health leadership people in the next decade. And for that, we developed, One Health benchmark and food safety with AUCI, standing for Inter-University Council for East Africa. And for that, they will implement or they are implement this curriculum in different universities so that students can learn about things in
1 minute
for future. Okay, last slide. So from that, we can say that we have identified gaps and opportunity for One Health at CGIAR, and that would fit for our discussion in this session. I think that's the first point we have to say that this is very obvious that we need to strengthening the stronger cross collaboration between discipline and areas, especially embracing more environmental integration into One Health. So we all agree that. And UNEP, we are sitting here, they are responsible for that, and we want to work more with them. Plant health, soil health, biodiversity from other center of CGIAR, I mentioned from the beginning. We need to have a greater engagement with policymakers to translate research findings into actionable strategies and development of adaptable and context-specific intervention. That is the key highlight of our paper I mentioned from the beginning. We need to make the case for One Health, increasing evidence to attract investment to make One Health operationalized in different level. And also a very important point, I think, from the CGIAR and partner, we need to leverage the CGIAR comparative advantage to work on One Health. For example, INRI have labs in low and middle income country here, as a center sitting in the place where One Health issue come from. Why we don't move forward more on the pandemic discussion and having more project funding addressing these crucial topics of One Health, or we can set up kind of long-term research agenda on climate change and health as the human, animal, wildlife, environment interface. For example, INRI have a range capacity close to here. We work with other people to design this kind of long-term impact research project. And also don't forget that we are living with digital solution and AI that we can bring also in our research. So I just want to say that, that's the last slide to show that, for the new science program, One Health will be mostly with sustainable animal and aquatic food, but also some of the One Health work also be included in the multifunctional landscape, but also better nutrition and diet. And we try to bring different discipline and different center to address more One Health in our CGIAR system and partnership with other organizations. Thank you very much for your attention.
Thanks so much, and thanks for keeping time. We're going to do a big gear switch here because we'd like to invite Principal Scientist Jordan Chamberlain from International Maize and Wheat Center to talk about the synthesis of fertilization, soil health policies, and the implication for One Health. So we've been hearing about animal health, pandemics, diseases, but switch over to you. Jordan, I think you can use the mic right there, just on speak, and we can help you move some of the slides. Thanks.
So while we get started, let me just, Jordan Chamberlain, I'm an economist with CIMMYT based here in Nairobi. Really happy to be here. I should acknowledge that I'm not a One Health guy, so I'm not an insider, but I hope you'll take my comments as those of an interested outsider and potential collaborator going forward. Can you find it? Put it on the desktop.
Yes, sorry, colleagues in the room. We have a small space today, but thank you for the patience and please bear with us.
I think if we've got a couple of minutes while we're trying to get the presentation up, does anyone have any questions for Hung at this time? We just come up to the mic and ask away. So I'm assuming the One Health component in Hung's presentation was perfect. Anything missing? Yes, Mary and then David. Oh, David, go ahead.
Yeah, and thanks, Hung, and David Van Jeffries from Wellfish and working with Hung on thing. I think what we're expanding a bit more is this kind of the hazards in terms of particularly public health is a way not just focusing just on the zoonotics, but that kind of wider health effects. I think that's if we look at the UNEP and the quadripart definition, I think we're trying to bring in this more holistic health approach as well. And I think that's coming through as well from future work. Thank you.
Thanks, David. Mary, do you want to come to a mic here? Sorry, thanks so much.
Thank you so much. I think for me, Hung, the coordination needs also to include the continental perspective. I think this needs to be very strong. If it comes from the national level, we need to have very strong linkages to the continental level. I think we've been working closely with you under AU IBA, AU PANVAC, Africa CDC to sit at the table to drive a continental agenda.
Thanks, Mary. Any other person with any questions? Yes, please go ahead.
Is it working? Okay. I wrote mine down so that I don't forget anything. So the issue of One Health, which focuses on collaboration, especially at regional level.
Oh yeah, that's okay.
Okay. Sometimes it feels like the collaboration is usually due to maybe the grant that we receive and stuff like that, which you might think as if it's kind of forced. So what are some of the things that can be done to ensure the collaboration is very strong and all the aspects of One Health, especially the aspect of environmental health and plant health, are kind of focused on? Yeah, thank you.
Thanks, Hung. And before you answer, I think we'll come back to that. So just hold that question because I think we've got Jordan back online. Jordan, over to you.
Okay, yeah, thanks. Great. Okay, so good to be here. I'll be trying to summarize some work that we're still doing, frankly, to kind of take stock of the current state of policy-oriented research around fertilizer and soil health. This is part of a special issue that I'll describe in a second, but a starting point would be why now? I mean, there's decades of research on fertilizer profitability, how well subsidy programs work. Well, the big motivation for kind of coming back to this and kind of updating our kind of empirical understanding of the state of knowledge here has been the global supply disruptions that we've all experienced over the past few years, which have resulted in food, fuel, and fertilizer price shocks that all of us are familiar with. I'm not going to go into detail here, but the question is, how have these global trends played out in local economies and in smallholder farms and many of the systems that we're working in? And so that was really the motivation here. A lot of this work is being compiled in a special issue food policy, which you're welcome to go take a look at now. But the motivating questions for this work have been to ask, first of all, how have global supply shocks affected fertilizer use, agricultural productivity, and soil health in these different contexts? And what policy interventions are needed to navigate periods of market volatility? And then kind of more broadly, how do we reconcile the imperatives for ag productivity growth, which often rely on fertilizer as a central component of that strategy, with broader sustainability and well-being objectives in an increasingly volatile context? And so this is really where the One Health kind of analytical perspectives become relevant. And what I'm going to highlight here is kind of what we've done so far, but also what some of the gaps are. And I think that's really where more work can be done to flesh out some of these broader linkages with a One Health agenda. So some key findings, let me highlight. First of all, the global to local transmission of shocks has been, first of all, asymmetric. So while many economies were quick to kind of feel rising prices in local markets, after the global price shock kind of died down in 2022, some regions were slower to go back to normal, if you like, to follow suit at the tail end of those of those spikes. In particular, this was the case in sub-Saharan Africa and some other developing regions. We're still trying to figure out why, what the source of those asymmetries were, but weak trade networks and infrastructure, market power concentration are some of the likely culprits there. Another key point is that there's been substantial internal heterogeneity in how these price shocks have played out locally. And again, a lot of interesting detail that we don't have time to go into. But as an example, Kenyan farmers felt average price surges in DAP of 81%, but that ranged from increases of 5% to decreases of 5% to increases of 140%. So massive heterogeneity internally. And again, a lot more work to kind of unpack what's going on there. Interestingly, fertilizer subsidies may have shielded price increases in Kenya in some areas, but have also seemed to have slowed recovery afterwards. What does this mean for farm management? How has this changed the decisions that smallholder and medium and large farmers are making on their farms? Well, the key idea here is what fertilizer prices are doing in relation to output prices and fuel prices, of course. But a key kind of analytical tool is to examine what's happening with fertilizer food price ratios over time and space. And a high level outcome from this analysis is that while farmers in the developed world largely didn't suffer very much because you had food prices and fertilizer price spikes co-occurring in time, that hasn't been the case to the same degree in sub-Saharan Africa and other developing regions, where the input-output price ratio increased substantially, meaning that it was less profitable to use these inputs. Unsurprisingly, we've seen fertilizer use declines in response to those shifts. We've got still very imperfect information about how that's played out across all the geographies that we're interested in, but demand elasticity estimates, and they're all over the place, which kind of highlights some data collection issues. But a key takeaway here is that smaller farms are relatively more responsive to changes in fertilizer prices than larger farms, as we would expect. What policy responses have we been looking at? Well, there's a lot here, and I'm really going to just maybe highlight the role of subsidies, which is, this is a very convenient policy tool, way to manage supply and prices of fertilizer. And this, these are politically expedient. They do tend to result in yield increases and address some kinds of food security concerns, but they're probably not the most efficient ways to do that. That's what the corpus of research tends to suggest. And there are important trade-offs, right? So you dampen market integration, you can crowd out the private sector. There's benefit capture by larger farms and other kind of targeting issues. And they tend to incentivize overuse, at least in some systems. So South Asia would be an example of that. Work on kind of market structure, won't talk about that. There's not a lot of evidence there. There's been increasing discussion, though, about how to improve the effectiveness of subsidies. And one way to do that is by investing in agricultural research, development, scaling. And here we kind of tap in. Now we're starting to look at some of these linkages across traditional ways of examining fertilizer, in particular looking at soil health investments. And we know that soil health investments can improve the returns to fertilizer for smallholder farmers. They improve nitrogen use efficiency at the farm level, but they also improve the returns to investments that are being made in, for example, subsidies. There's a deep agronomic and soil science literature to draw on. There's still limited economic evaluation, but the work that does exist tends to support this. The graph on the right is showing, this is some of my work from Tanzania that shows that indeed kind of micro level evaluations of the returns to fertilizer, the profitability of fertilizer, are strongly conditioned by measures of soil health like carbon stocks. So the question is, how do we scale up these virtuous practices that can help improve the returns to fertilizer use? And here, this is a contentious area of research. We've got lots of evidence, but it doesn't always point in the same direction. It depends how you measure things. But it does underscore resource constraints in making some of these investments by the farmers that we care about. And I am not going to talk more about that because we're running out of time. But let me just also hint that there's an innovation pipeline that can be brought together here. So things like breeding for nitrogen use efficiency. We've got other work that is kind of exploring better digitally enabled tools, AI-enabled advisories to kind of help farmers make better decisions, reducing barriers to establishing circular markets, et cetera. But balancing productivity with other goals is an emerging theme. There's growing evidence of trade-offs of fertilizer overusage. I'm highlighting a few things here. This is the tip of the iceberg. Some human health outcomes for systems that have that are being that are linked with fertilizer overuse. I guess the takeaway here is that economic frame, even though we've got bits and pieces of evidence to work with coming from the biophysical side, economic frameworks are lagging a bit behind for identifying optimal fertilizer usage levels in different contexts and for implementing the insights from those analyses to actually implement subsidy policies to induce kind of optimal levels in the ground. This is where I wanted to end up, which is really kind of highlighting areas that I see as opportunities for us. So when we put out the call for papers, we were hoping to get a lot more work from our biophysical colleagues, kind of looking at some of these linkages, certainly on the soil health side, but looking beyond that as well. And we really haven't seen that come in yet, which is not to say that these aren't interesting areas or are areas that lack research, but that we need to kind of pull that into this corpus of kind of policy-oriented work that we're doing and connect the dots a little bit better. So the 4 areas that I would want to highlight as being of particular interest are looking at agronomic biofortification. So there's some work on zinc here in maize and other crops. I think the economics is still not clear there, whether there's a viable scaling pathway or if there are cheaper ways to do biofortification, but that's an area of importance. The economics of organic production and smallholder systems. There are many technologies out there, but they're not scaling, and there seems to be economic reasons for that. But again, this is also linked with escaping commodity markets and looking for new market opportunities that would incentivize organic production. And then finally, thinking about the linkage between soil health into fodder quality, what that means for livestock quality and human health outcomes through dietary channels. And then looking at it the other way, thinking about the role of animal health and how that influences manure quality and what that means for feeding our soils and for crop agricultural outcomes. So all of those things I think are really nice opportunities for us to look further at. Again, there's the QR code for the special issue where we're kind of assembling where we are right now, but happy to go further with anybody that's interested in this topic.
Sharon, thanks so much. That was a great presentation. And thank you for keeping to time. I appreciate that. I'd like to now invite the Director of Research from African Plant Nutrition Institute, Shami Zingori, to address the key targets of the Nairobi Declaration on Fertilizer and Soil Health. Over to you. Thanks.
Yeah, thank you very much. I think while we are setting up the presentation, I could just provide a brief background. I work for the African Plant Nutrition Institute, and this is a nonprofit science-based research organization with a primary focus on soil fertility management, plant nutrition, and sustainable crop production. We do partner very closely with several CG programs, including ITA, ICRISAT, CIMIT, and others in addressing issues related to sustainable soil fertility and soil health management. And together with the CG partners and other broader stakeholders, we supported the African Union in developing the African Agenda for Fertilizer and Soil Health. It's a 10-year declaration supported by an action plan defining some of the core investments that the African Union will be making to address some of the land degradation challenges and improving soil fertility and soil health as well. We see soil health as a key foundation for One Health, and PNI is very keen to further develop partnerships with the One Health platform of the CG to be able to connect One Health as part of the core One Health framework as well. And I need to turn over to my presentation. So in a way, Jordan has laid a very good background for what I'm going to talk about. And I'm mostly going to approach this from the biophysical dimension, which is very complementary to the policy dimension that Jordan was talking about. So first to highlight the significance of the investments in soil health and the challenges that the continent faces. At the core of agricultural challenges we face on the continent is the whole problem of inadequate investments in soil fertility and soil health management, mostly expressed through low nutrient applications and also poor nutrient management. And this translates into nutrient depletion, which is actually estimated at about 30 kgs of nutrient per hectare that are being lost from each hectare of cropland on the continent. And long-term nutrient depletion leads to soil degradation, and it's actually estimated that over 60% of the actual land on the continent is degraded. And this is a big soil health challenge that the continent faces. And then this also then is expressed through other environmental challenges, such as carbon and biodiversity losses, greenhouse gas emissions from area expansion and from carbon losses, both below ground and above ground, and then also climate change aggravation from land degradation and poor soil health. And then at the human dimension, this is very much a key basis of the human food and nutritional challenges that we face on the continent. And addressing human health without paying close attention to the nutrition aspect will be a key missing element as part of the whole One Health framework. So as part of our program in APNI, we want to foster new partnerships that allow us to address the broader support of soil health for One Health, mostly focusing on context-specific solutions in integrated soil fertility and water management that allows us to improve health and provide broader support for One Health, through crop, sustainable crop, livestock, and human nutrition. Just to define soil health, I just wanted to this marker here because there are various definitions, but at the simple basis is the interest to look at soils as a living ecosystem that support key functions of plant growth and maintaining water and air quality, and then also promoting biodiversity. So this is a very key part of ensuring that we have a strong foundation for supporting One Health. And across Africa, we do encounter the key challenge of land degradation. And with this background in place, the African Union, with the full support of member states and head of states, convened in Nairobi in May 2024 to ratify the continental agenda for fertilizer and soil health. And this has put soil health at the top of the development agenda on the continent. And I think it's a great opportunity to capitalize on this political and policy momentum to actually ensure that we provide the complementary components that help to fully capitalize on the investments in fertilizer and soil health to deliver broader impact on the continent in the One Health space as well. What are the key elements of this framework? The vision is to actually reverse this stuck reality of land degradation by accelerating inclusive agricultural transformation that will end hunger and malnutrition. And there are several commitments and targets, but I wanted to illustrate some of the core targets of interest here, which includes increase in organic and inorganic fertilizer use, but also making sure that it's sustained and used in a sustainable way by providing site-specific agronomic recommendations that are tailored to the specific context of the diverse cropping systems on the continent, and with the target to also increase crop productivity and double crop yields in the continent in the next decade. But I wanted to highlight the key interest also in rehabilitating 30% of the degraded soils on the continent and moving degraded soils into a more healthier status on the continent. And how would this be achieved? There are four outcome areas that the action plan is providing support. Two, based on creating a policy and investment enabling environment. And then number two, looking at setting up the infrastructure and supporting market development and value chains that improve access and affordability of both mineral and organic fertilizers as well. And then outcome three is where APNI, together with our CG partners, have been very at the forefront in working, ensuring sustainable use of plant nutrients and making sure that we are working on a trajectory of sustainable crop production intensification. And then there's the component of enhancing institutional and human capacity for sustainable soil health management on the continent. And a key part of the interest in the action plan is harnessing multi-stakeholder partnerships that drive the investments in policy, finance, technology, as well as capacity development to provide the necessary support for delivering the commitments of the action plan. Then I wanted to end with this slide here, just to illustrate and highlight the foundational role that soil health plays in the One Health framework. The One Health framework is conceptualized as an interaction between three components: animal health, environmental health, and human health. And Jordan, in his last slide, provided a very clear opportunity for connecting the components. But then I just wanted to emphasize the critical role of soil health in holding together the fabric of One Health. And part of the interest in soil health is the multiple support functions that it enables across the three dimensions, which without those connections, we will not be able to have a sustainable One Health framework. And some of the key direct human benefits include food and nutrition, providing clean water, and actually providing key medicines that are needed for supporting human health, and then several other functions that support environmental and animal health as well, directly derived from improved soil health management. And this is an area where APNI would like to foster partnerships, ensuring that soil health is well integrated as part of the CG One Health platform as well. Thank you very much.
Shami, thank you so much. That was great timing. We're making up on some time. I'm going to still ask that maybe if anyone has any questions, just to hold off just for a bit so we can get into our panel discussion. So you've heard from all of our speakers, we've got the endorsement of the AU Fertilizer Soil Health Action Plan, and there's an increasing pressure on sort of food, nutrition systems, and there's a need for us to join up and link up. So what we're going to do is we're going to shift a little bit and get into a panel discussion to discuss some of the reflections you've heard, but mainly on sort of what are some of the innovations, best practices, policy levers, as well as potential behavioral change components that we need to look at the regional and global level. With that, we are joined with our panelist, Lillian Wambua from the World Animal Health Organization. Lillian, thank you very much for being here. Kibroma Bey from the International Food Policy Research Institute. Esther Mugi from African Plant Nutrition Institute. Esther, can I ask you to maybe move over where Hung was? That would be great. So we could just have all of you together. And then I have Douth and the Vice President of Vietnam Academy Agriculture Sciences, who's going to be our national representative. So thank you very much all for being here. So a very quick reflection to all of you. I'd like to start and maybe just sort of in that same order. What innovation, partnerships, and policies are needed to break down some of the barriers between the sectors and making One Health more coordinated? As you have seen here, Hung described something very different, as did Jordan and Shami. So what can we do? And maybe I say ladies first. So Lillian, can we get started with you perhaps? Thanks.
Thanks, Hector, and good morning, good afternoon, wherever you're joining us from. And thank you for inviting the World Organization for Animal Health to this very important panel discussion. In terms of, addressing your question, I would say that we already have had what One Health is, but I want to emphasize that One Health is an approach. It's not an means, it's not an end in itself, it's an approach. And what that means is that if we were to visualize a value chain in which we end up with the product or our final product being global security, development, as well as sustainable livelihoods, if that is the value chain we are looking at, and that's the final product that we're looking at, then One Health is the approach that we ought to take for us to achieve those critical goals. And so in that respect, again, thinking about the analogy of a value chain, it has to have different components. And we've already heard a lot about the various components, but I want to emphasize and underscore that we need the partnerships. We need the partnerships, we need the sectoral integration, leaving no one behind. But also we need an enabling environment that is anchored in the relevant policies and legislative frameworks at all levels, including at country level, at regional level, at global level. And in addition to that, we need what you are doing in the CGIAR. We need the data, we need the evidence that is going to help us anchor our policies and create that enabling environment that can break down the silos and the barriers. So again, thinking about One Health as that approach that enables us to drive the value chain. It's important, again, to emphasize that all these components are very, very important. And therefore, the strength of that chain and that system is going to be as strong as the weakest link. So we need to add everything into that mix of components. Thank you.
Lilian, thanks so much. Kibrom, over to you, same question. What's needed? What are the policy levers and or partnerships that are needed to break down some of these silos?
Thanks. So just a disclaimer, I'm not a health expert in the sense that Hong was talking. I'm an economist, but I can see an interesting angle to public policy, and I'm going to focus on that. I think if you think of, I'll start with an example. If you think of some of the agriculture policies in Africa and many other Asian countries, the first generation policies had focused on increasing the use of fertilizer to ensure food security. But we are increasingly feeling additional externality effects, particularly, I mean, if you see what happens in those countries that have succeeded in achieving that target. For example, if you see several countries in Asia and even in Africa, countries like Egypt, which have successfully increased utilization of fertilizer, we're seeing the external health effects, particularly on human health, on environmental health and soil health. And I think that's one of the key trade-off that I'll pick from what Jordan was saying. So what that means is when we think of public agriculture policies to achieve food security targets, it's critical to consider other instruments that can help us address some health dimensions, particularly in relation to excessive use of nitrogen, excessive use of phosphorus, that had been ignored. And I think that's quite, for me, quite a missing piece worth highlighting. With that, I think I'm seeing a lot of experts, and I'm happy to leave the remaining time for them to speak.
Thanks. Esther, over to you. What are some of the linkages and partnerships needed? So just speak into that mic or one of them. Thanks.
Thank you very much, Hector. I would like to emphasize on the need to have enhanced communication, also data sharing, and also intersectoral collaboration. And there's also a very good need to try and clarify the One Health framework. And let me point out at the use of a user-friendly data sharing platforms that are digital that would allow for real-time data sharing and also communication between the different sectors of One Health. When I talk of different sectors, I'm talking of soil health, I'm talking of plant health, animal health, human health, and not forgetting environmental health. Then we could also try to have some initiatives where we have professionals from the different sectors come together and we could invest in joint training programs and also capacity building efforts to try and have a common understanding of One Health principles. And this would help in making sure that we are having a holistic approach to One Health challenges. And then with these professionals, then we could also arrange for multi-stakeholder forums where we have regular dialogues of these professionals to make sure that we are every now and then reviewing what we're having in One Health. And this would really help in fostering a common understanding of One Health principles. Thank you.
Thanks. Dao, to you.
Thank you. So I'd like maybe to share user experience in Vietnam because I'm also I'm not a technician, I'm agricultural economist, and I'm also the national food system convener in Vietnam. So I think that One Health approach is for practices. And in order to promote in the large scale, we need some institutionalization. To see how the governmental system, the different ministry. So One Health is in between Ministry of Health and Ministry of Agriculture and Environment, is the case of Vietnam. So we would like to enabling the environment issue, policy, environmental issue for the One Health operation, in order to mobilize also the national resources, not only depending on the international resources from CGIAR or from FAO. This is for beginning. So we already established the One Health platform as facilitated by Ministry of Agriculture, and we have the Ministry of Health on the board and different international organizations. First of all, we have FAO, INRI, is ASEAN. And after that, we can have the World Bank and FAO later on the food safety working group. So One Health in Vietnam, we start with the zoonotic and mostly emphasize during the COVID because it's the risk of transfers of the disease from animal to human is very highly a risk. So, but now we think that One Health approach is can contribute to the different outcome of the food system. So in Vietnam, we also since 2023 we established a national action plan for food system transformation, and One Health is one pillar activities of this action plan, and we work together with the agroecology approach because, and now we are step by step integrating soil health, controlling of plant insecticides, and also emphasizing on food safety and controlling the antibiotic. Because the antibiotic not only coming from livestock, but also coming from plant protection. Farmer practice a lot of, and if you want to protect and to manage environmental issue, we need also this integrated approach. And now we, in our network, One Health in Vietnam, we have near to 200 member organizations, different, including public and private sector. So the communication is secondly important. And we think that the data, also data sharing, data platform using maybe digital tool for large scale communication is also very important. Thank you.
Now, thanks so much. With that, I think it's a good way for us to start with maybe Lillian. Lillian, WOHA have long championed animal health within One Health. So how can sort of some of the international standards and partnerships be operationalized in One Health when it comes to environmental health, plant health, and today's sort of soil health? What are some thoughts there? I know it's a little bit of a challenge, but let's hear it.
So thank you very much. Again, the World Organization for Animal Health is a standard setting body of the World Trade Organization, we are mandated to set international standards for animal health as well as zoonosis. The process of setting international standards in this regard is very much inclusive. We are a member-driven organization, and so our standard setting process is member-centered, but more importantly, it's also anchored on scientific research and evidence. And I want to point out the fact that we partner very closely with organizations that we call collaborating centers, as well as reference centers or reference laboratories to provide the evidence that we need to anchor the international standards. And all the international standards are set for animals as well as aquatic animals. So not only terrestrial livestock or even wildlife, but also aquatic animals. And all these international standards are documented in the format of codes and manuals, but also in line with that, we also provide guidelines. Someone mentioned about issues of wildlife. We also provide guidelines for, wildlife health. Why are these international standards important? They're important in the context of international and national trade. You want to know how your neighbor is doing in terms of their animal health disease situation. So you can look up how they are doing in terms of looking up the global database that we call the World Animal Health Information System, where countries report the status of animal health in their countries for about 117 diseases. So international standards are important in the context of enabling safe trade. And I think this trade the trade of animal products has bearing on human health as well as other forms of health. Again, I want to emphasize also the critical role of the veterinary services in securing One Health, because often we hear that emerging diseases start from animals. Of course, they start from communities, but animals have been long incriminated, including wildlife, for emergence of diseases. And so observing these international standards enables us to raise animals in a safe manner. But also we need to skill the workforce, the veterinary workforce, to be able to do their job very well so that they can contribute to the prevention of emergence and spillover of diseases from animals. So this is what we do. And I would invite everybody to also put out an eye on the World Animal Health Information System, which is a critical database for, looking at the global animal health situation as reported by countries. Thanks and all.
Thanks, Lillian. I appreciate that. We will come and how we're going to be integrating soil health to Esther in a minute. But Kibrom, maybe we start with you. From your experiences in sort of agriculture, economics, and development strategies, what are some elements that are missing to develop strategies when it comes to One Health approach?
Thanks. Well, I think so I think one of the key elements that I think missing is what we call policy coherence, in the sense that when the Ministry of Agriculture wants to expand, for example, use of fertilizer, then there is a lack of coordination on what that means to human health and to environmental health, and I think creating the policy coherence at different levels, national, subnational, would somehow address that missing piece. It's also important to consider that some of the gains from, for example, using fertilizer is private, right? But if you think of the loss in soil health or the loss to human health, it's public. So having a sort of policy instruments that can address these different dimensions is critical, and that's what we are missing. So yeah, creating that that level of coherence, and also ensuring that we have the right incentives for either for farmers or for other actors to pursue that coherence is critical. Thanks.
Thanks, Kibram. Esther, then over to you. You know, we keep hearing about sort of in sort of One Health, when we talk about zoonotic diseases or animal health, we know there's a baseline, and then we know when there is a problem. So if we like use your expertise in sort of soil fertility management, are you able to share with us a little bit on sort of how we can integrate soil health into some of the CGIAR programs like SAF? That would be great to hear some of that. Thanks.
Thank you very much, Hector. Let me start by saying that soil health is fundamental for One Health. And why am I saying this? I'm saying this because nearly 90% of the food that we consume as human beings, including the fodder and feed by animals, comes from the soil, either directly or indirectly. So then we could try to integrate soil health into One Health by prioritizing some of the agricultural practices and technologies that enhance soil fertility and also biodiversity and resilience, while trying to make sure that we are not impacting negatively on human health, on animal health, and also on environmental health. And when I talk about environmental health, what I mean is that we try to produce healthy and nutritious food for humans, and also feed and fodder for animals, including aquaculture. We're trying to address some of the environmental issues that are associated with soil health, like nutrient mining, like also issues to do with greenhouse gases that were mentioned earlier by Shemi, and also trying to address other issues that are associated with soil health, like deposition of excess nutrients into the aquatic ecosystems, which could actually lead to eutrophication. And I would like to point out one potential entry point that we've been using at APNI, which we call the 4R nutrient stewardship, which what the 4R nutrient stewardship, it provides a framework for efficient and effective nutrient management. And what we do, just as the term 4R, it's 4 rights. And what it ensures is that it ensures the right nutrient supply, the source that is, and applied at the right rate, at the right time, and at the right place. And what the 4R nutrient stewardship tries to do is that it ensures that it creates a very healthy link between plant nutrition and healthy production of agricultural systems and landscapes. So there's therefore need to make sure that we integrate soil health into the CG's focus of sustainable animal and aquatic foods, because then there is a very good link between the nutrition and the healthy agricultural systems and landscapes. Thank you.
Lisa, thanks so much. I appreciate that. I'm sure the World Fish team here is going to be happy to hear some of that. Dao, over to you. Sort of reflecting on what has been going on in Vietnam and the experiences you have. Are you able to share some of the lessons learned when it comes to sort of policy level levers, as well as sort of institutional collaborations that could be shared or even rolled out?
So I already talking about the kind of institutionalization is important for the country like Vietnam to realize policy and to mainstreaming the One Hand approach in the different food system program, etc. So I think that currently we established the One Hand partnership. And we also calling for different international organizations and Vietnamese organization, private sector to sign commitment with the platform in order to manifest the commitment, and also to share who do what, because we have a lot of and now we are developing a new project, try to integrate it, plant health and soil health into the One Hand. So we cooperate with CGIAR, with Kabi working more on the biosolution, plant protection, etc. Try to invite different organizations working in different matter, and together with INRI, FAO is a classical. And the most important is that to realize and to test the One Hand practices at local level. and bring this capacity to local level, because we can have very talk, nice talk and publication, etc. But the most important and how to see at local level. And if we can see at local level the capacity building for extension worker with the one hand approach. So now we are trying to design a new project on the kind of a one hand clinic at local level in order to give the capacity building. And for this, the capacity training document produced by different research center like INDRI, FAO, or CGIAR is very important to support us. So for this, sharing the knowledge and document is also very interesting to go faster and not only based waiting the result of the research. And because for the National Action Plan in Vietnam food system, so now we still have 6 years to the 2030. That means the requirements for progression is also the presence for government. So I think that maybe the research activities or initiative like one hand also can support us to realize this kind of objective. That means not depend on the research. Before the research push the government, now the government gives the pressure on the impact for the research. So I think that this is the way that how policy and research and not only national research but it's international organization working in Vietnam are realizing. Thank you.
Now, thanks so much. And I think there's, even yesterday, we heard the same thing, that there's need for more integration. So I want to give time to everybody else in the audience as well to ask some questions. So what we'll do is just sort of wrap up. And I just want to ask to each of our panelists, what do you believe is the next action point? We have got together here at the CGIAR Science Week. It's been great. I think I'm glad that they forced sort of the animal health and the soil health to converge and merge this session. What do you believe, whether it's a policy lever, an action point, what do we need to do to move forward? What should be the priority action area as we leave from this space? Eliane, you want to go first?
Thanks, Hector. I would like to emphasize on the need for having a transdisciplinarity in partnerships, because from all the sectors, plant health, soil health, animal, human, and environmental health. Because if we have such kind of a transdisciplinarity in partnerships, then it would enable us to leverage on collective expertise from all these sectors and ensure that efforts such as research and development and also outreach efforts are well coordinated within One Health. Thank you.
Thanks. And also building on the point of partnerships, I think we also need more evidence, specifically the kind of evidence that enables us to understand and, to really grasp the benefit of the One Health approach. I think the One Health approach has been called many things in the past. It's been called One Medicine. It's been called, whatever, so many different kinds of names. So One Health approach is not new. But what we really, really need is the kind of scientific evidence that helps us to really grasp the value addition of applying the One Health approach. And for us to be able to do that, we need organizations like within the CGIAR and other evidence generating kinds of organizations, the academia, because as it was mentioned, most of these issues start and end at communities. So we need the community buy-in. How do we get it? We get it by communicating the evidence that is solid and that is scientific based. We need the buy-in of the countries so that we can get domestic funding to support the One Health projects, One Health initiatives, and the One Health approach. How do we get this? We need the evidence to convince the policymakers as well as the private partners to invest in One Health. Also, we need the regional buy-in. You've had our colleagues from the Africa Union say that we need the One Health agenda to also be bought in at regional level as well as at the global level. So evidence, evidence, evidence. And kudos to all the work that you do.
Thanks. Kibram?
Yeah, I'll be brief. So when we were coming for this session, we were not sure whether soil health fits into this, but I can see it definitely and squarely fits. But what that tells me is there is a need to integrate even within the CGIAR efforts. I know there is a lot of work on soil health in the sustainable farming. So I think this is a good start. Let's continue doing that. At least to start doing building the conceptual framework, and then we take it down to the ground. Thanks. Let me stop here.
Oh, I see you guys already making advancements in integrating soil health, but what can we do? What's the next action area?
Yes, I think that I agree that we need to more evidence. But I think that the partnership in general, you can commit, but here I focus more on the need to have some concrete intervention at the local level. That means we need to design some actions that different partner working in the same territory. Not just mean every organization working in different area and we share information. So at the end, we don't have really one hand. We had to show one hand in some territory, flagship, etc. So like the evidence from this, and economic evidence is also very important. I think that I am very glad that IPRI joined only One Health, not only the technician society. This is very important for the policy maker. And I think that, yes, with this we can communicate better, so we can show and also I think that for this, one hand related to different outcome, and we have to develop the maybe impact assessment methodology appropriate to the one hand approach. And I see that, for example, soil, but in a rural area, we cannot separate the soil hand and water quality. In general, if you assess the soil hand, the water quality is very important because water is bringing insecticide from crop to the. So absolutely, we need the integrated team working in the field. Thank you.
Dao, thanks. And I know we've got the International Water Management Research Institute also integrated in the SAF program. And in terms of soil, we're collecting soil samples to look for pathogens, but there's clearly more that needs to be done as far as nutrients are concerned. So thank you very much. So a round of applause to our panelists, please, first. And with that, I'd like to open the floor out for some questions and to our panelists or to any of our speakers. But I notice we've got Papa Sek here. Papa, thanks for joining us from Prizod, the president of Prizod. Can you share some reflections before we get started? Thanks.
Thank you so much, Ekta, for giving me the floor. First of all, I would like to say good morning, good evening to everyone. I'm very pleased to respond to the invitation of CGIAR. This is very important conference. And I would like to say some few words on One Health approach and One Health communities. As you know, I'm leading one of the enabling instrument of the One Health approach, which is Prizod, preventing zoonotic disease emergence in them. But Prizod is really connecting the global decision maker to the local communities. And as Emma told previously, we need enabling instrument for the One Health approach. And Prizod is one of those instruments because we have a project on the field. Mainly we have in Africa, the African project, which comprise countries like Madagascar, Cameroon, Senegal, Guinea, but also Cambodia for the south. But also we have some cool program or project also which comprise countries on the Asian part. So all these project gathers local communities, but also government and also private and public actors working together to make people more aware about what is the connection between animal, environment, and human health. And it's very vital because, as you all know, from the COVID-19 and Ebola, we realized that we missed something. It's because in the past, people were working in silo. And now with President, we are supporting countries to break those silos. And I can say that what is decided and prepared globally is or today's translate on concrete action on the field. And that's really the task of and the aim of PRESERVE. So for those who do not know what PRESERVE is an initiative, international initiative launched in 2021 in Paris. And we have a governance body, the General Assembly. Now we have 57 members throughout the world. Among those members, we have 30 government, but also we are present in 80 countries in the world. And I'm leading the General Assembly, and we have technical and scientific working group working in different aspects and different also sectors which really relate on zoonotic disease prevention, which can potentially become pandemic. Thank you.
Thanks so much, Pava. Appreciate that. Mary, and then I see David, you had a question. Mary, over to you, please.
Thank you so much. I need to leave, but
Mary, you can introduce yourself very quickly if anyone doesn't know you, and then
Yes.
just who you want to
Okay.
ask to.
So I'm Mary Mbole Kariuki. I work with AU IBA, and I'm the One Health focal person for that. So I just want to, I'm really glad. Thank you, panelists. That was really good. And it's really leverages on what the African Union is doing that was endorsed by the heads of state. So we were asked to come up with an African Union digital One Health platform that will drive data actions, and not data collection, but data integration and sharing. And it was very good to hear about the issues of the soil health. So through this platform, based on the evidence that you're given, I hope the CGIAR centers will be able to offer the research evidence that we require to be able to give information to the heads of state on what needs to be done. So for this platform, really, it's just to share what we are doing and to hope that we are going to be able to work very closely to be able to get that research. AU does not do research, but you do research, and that's what is really going to influence what the policymaker needs to do. So leveraging on this, I hope we're going to be able to have more interactions. Collaboration is the way. I like the way we've talked about the plant health. We've been struggling with that. Environmental is, we've been leaning more onto the climate actions, but through this meeting, we can clearly see what needs to be done and how it needs to be done. So thank you so much. We wish you well, and we look forward to working more and more strongly together. Thank you.
Mary, thanks so much. Jordan, David, did you have a question? Okay, well, you're welcome to make a comment. I'll give it to Jordan and then to James.
Well, thanks. I mean, I just wanted to pick up on one thing that Kibro mentioned about how to integrate this into how we're organizing ourselves now under the current portfolio, right? And it seems to me that there's lots of activities. I mean, Sarah's doing some great work, for example, in BDN, looking at some of these linkages. Absolutely has to do with policy coherence, animal health issues with tick-borne disease in Uganda that also have human health implications. Super interesting work. I guess my point is that it's kind of atomistic right now. I mean, we've got work in animal and aquatic foods with policies, BDN, sustainable farming. We don't want to recreate the portfolio, but there could be some scope for kind of, I don't know, we don't need any more working groups probably, but finding some mechanism just to make sure that we don't lose track of all the bits of this and articulate how that fits into a bigger conceptual agenda. And so we're not losing some of the evidence that we have to contribute to kind of an informed discussion. a second quick point is that there's evidence and there's evidence. I mean, I love what you're saying. I think that we need to do more work on generating evidence in terms of cost benefits, right, for policymakers, because often that's what they want to know. So what are the economic returns to policies that generate, outcomes in different outcome domains that we're often not kind of, don't come together in our accounting frameworks. And this includes doing a better job at dealing with externalities and things like that. I'll leave it there. Thank you.
Jordan, thanks. James?
It's not James, it's Amos. All right, so I'm Amos working with ERI. So I just want to give one comment and one question. So a comment is on integration of information or evidence. So we are asking countries to come up with a way of integrating all these systems where data is being reported so that it can be very easy to access. I think this also has to translate at also a higher level, because we are seeing, I'll give an example of antimicrobial resistance, because that's the area I work in so much. We're having a situation whereby we have so many systems where countries are reporting to, and these systems don't speak to each other. We have ONET, InFarm, Animuse, so it has to integrate at each and every level. And then the second question, I think, goes specifically to Vietnam, because probably they already started doing this. We are seeing so much investment by the private sector into One Health platforms in different countries. Maybe share some of the lessons you learned with national investment, because we're seeing, we have a case whereby we have so much donor-funded projects. I'll give you an example of antimicrobial resistance, where there's flaming fund coming in, whereas governments are not really into this work. So maybe share lessons learned from FLLMIC, so that probably what can countries do in order to have a lot of national investment into this area. Thank you.
We have, you know that the national funding system is very disciplined. We have everything. We have One Health, we have veterinary, we have the nutrition program. They have already some line. That means we have, we cannot say we don't have anything, but how to integrate, but the use is very fragmented and also limited, so the allocation. So we cannot see the integrated impact for some territory or for some localization. So this is the problem. And how to do this? We not in one hand yet, but for the food system, because food system now we reach the same principle. It's very fragmented. So we need to work with, because at the macro level, we have a very disciplined, but every financial flow come to rural area, come to province. So this is the area that we have to integrate and to design some integrated intervention with farmers, because we have only one farmer and they receive different programs from the government. So I think that currently for the food system, and I think that this kind of experience can be tested under the One Health initiative in Vietnam, that we work on the capacity building on how to integrate different government resource flow for the integrated approach for One Health, for food system, etc. So this is our thinking, because changing the completely the system budget allocation is not easy. It's for more long time. Thank you.
Thanks. And with that, my timer is telling me it's off. Any last burning questions for anyone before we? Yes, please. You could just introduce yourself.
Thank you very much. My name is Steve, and I want to ask, I don't know, yet Kenya, you have had allegations that the agrochemicals which are banned and are still getting into your farms, and they are still getting into our farms through probably insecticides, form of insecticides and the rest, and finally ending up in our plates as we are taking food. So I don't know, and probably my take is that probably proper policy legislation should be initiated so that there should be watertight and prevention of this and banned chemicals.
So maybe Lillian, maybe I can divert
Yes.
that one to you. Just so, I mean, just speaking from the animal health perspective. So Steve, if I hear you correctly, you're asking about regulation of antibiotics, pesticides that are coming in,
Yes,
showing up in the farms and
Yes.
then into the plates.
Yes,
Any
exactly.
thoughts on that?
Yeah, absolutely. We work with countries, of course, in the context of available funding, to, encourage good stewardship of antimicrobials. Antimicrobials, anything from antibiotics, but that's the focus at the moment. But antimicrobials will also include things like acaricides and antihelminthics, the drugs that we use to treat worm infestations. But speaking specifically on antibiotics, WAR works with countries to encourage regulation of antibiotics, especially the antibiotics that are critical for veterinary medicines. Because most of the time you find that these medicines also, the classes of medicines that we use in the animals are the same classes, broad classes in terms of their chemical classification as what we would use for humans. And so you find that any excessive use in animals will lead to resistance also in humans. We're also grappling with the issues of substandard and falsified medicines, because that is, something that we would like to encourage and capacitate the regulators at national level to control these falsified and substandard medicines that end up in our markets and in our farms and also now on our plates. And so basically WAR works with the veterinary regulatory bodies. Yeah, so for example, the veterinary medicines regulation body in Kenya, to ensure that we strengthen their capacity to regulate these medicines, both the authentic medicines being used in the veterinary sector, as well as the substandard and falsified medicines. Yeah.
Thank you so much, Lillian. I think with that, we'll close our session and I invite Hung to give some closing remarks. Thank you everyone for your time here.
Okay, thank you very much. So before that, I would like to have a big round of applause for Ekta for the excellent moderation. Thank you very much. And before I give the concluding remark, I would like actually to recognize my boss, Dr. Fabian Kaus, the DDG of Research and Innovation of International Livestock Research Institute. So welcome, Fabian. My late welcome, because you came in the middle. And also, I would like to say that, my DG, Apollinaire Chikeng, sent a message. He actually stuck in different urgent things of the conference. You know that, this conference is hosted by Caro, but, INRI's CG Center hosted by Kenya government. So we are playing a little bit kind of host. So our DG is very busy for that. Apologies from his side. I hope that you understand. Okay, first of all, I would like to thank you very much, everyone, in particular, our dear panelists. Papa Sek, you came from far away. I know that we were busy in Geneva negotiating the pandemic treaty, and you came here to give some remarks. It's very appreciated. But also all the colleagues, participants, and partners in the room, and in particular, people online. Apologies for the delay. I know that we started with 10 minutes delay, I suppose, and I hope that it's acceptable to have 1 or 2 more minutes for closing this thing. So I think that, for this session, we all agree that One Health is very important approach. Lillian, you work for INRI, and now you are wearing the hat of WAR in Kenya, in East Africa. One Health is an approach. It's not a methodology. It's not a golden bullet. We use this as an approach to bring different sectors to work together And today, David mentioned me that, at INRI, at CGIAR, we have the impact area biodiversity. And we have a very good session. We bring different together disciplines, and we recognize that, we are healthy when we have animal healthy, environment healthy. So we work on health. And I think that, Fabian, under his leadership, the new health program, but INRI, we don't call it animal and human health anymore. We call health program, and we work for healthy people, animal, and the ecosystem. And this reflects very much the framework that INRI and CGIAR want to embrace to make this one better. So One Health integrating human, animal, plant, and environmental health is no longer an option, but it's a necessity that we need to practice. So that is actually, I understand from this discussion. The second point I take from the discussion and also from my presentation and our colleague from CIMIT and IPRI, actually, this is in INRI and as a CG Center, we are now entering a very interesting phase of research for development. And One Health is part of the new agenda that you could see already that we launched the new portfolio 2025-2030 and the SAF program, Sustainable Animal and Aquatic Food System, together with better diet and nutrition and multifunctional landscape and some other program. We have here and there the aspect of One Health need that we need to bring together. So the silo at CGIAR, we are there. So I agree with you, Thiang, and some Kim Probon, so that even at CGIAR, we need to break the silo to work together, to bring really discipline and center together to realize One Health. That is very important for us. And I think that, I fully agree with you, Lilian, and also Mary from AUIBA. Partnership is key. That's why we develop with you the WA Collaborating Center on One Health to develop the capacity to different partners, not from CG alone, but we do together. So CG and quadripartite organization partnership is very important. But Mary, you remind me a very important aspect also that it's not about international and the country level. The continental and regional partnership is important. That's why our friend from Africa, CDC here, Mary, you are from AUIBA. I come from Vietnam. I work closely with ASEAN. That was featured 2 days ago at plenary. We need to work together at different level, global level, regional level, country level, but also at the local level to realize. So partnership is key. I fully agree. Another point, because CGIAR is finally a research organization, but research for development. So generating evidence is still our key mission. And actually, One Health is abstracted, but to be honest, we don't have enough case study or business case justification. And I agree with you from IPRI side that more business case of One Health need to be done to show to our investor policymakers to see the added value of One Health to invest in that. Our colleague from INRI show in some of case studies the investment return of One Health is a 3-to-1. I think that our boss initially from private sector, it looked like that it's a good investment return. So we need to show more case on this thing. And finally, I think that it's very interesting to remark that when you talked about pesticide, soil fertilizers used in agriculture, and we work from animal health side, the use of antibiotics and the use of fertilizers in crop production, you share the similarity. And for that, the solutions that CGIAR and partner develop have to have the incentive dimension. Why farmers have to reduce antibiotics in livestock if they don't have the incentive to do so? The same farmer in Vietnam, why they have to reduce the use of pesticide and fertilizer if they don't have incentive for that. Thiang mentioned that Vietnam, is number 1 or number 2 rice and coffee exporter worldwide. But I think that we all agree that we are worried about soil quality, soil health and plant health when we go very much on the productivity increase without paying enough attention of soil health and plant health. So plant health, soil health, animal health, human health share a lot of similarity in some of the principles of One Health we want to do, including the integration, intersectoral collaboration, and incentive in the solution we develop. So I hope that we have a very nice time with us, and for this discussion is useful for us to move forward the agenda of One Health, not only on human and animal health with David and and water health. And water health, I should not mention forget that as our colleague from IMI and World Fit will be disappointed. But together, I think that we advance the One Health agenda in CG with partnership with many organizations today and around the world. So with that, thank you very much for the attention here and online, and wish you a very good week here with CGIAR week. Thank you very much.
Thank you. Good.
Aita.
Maybe outside here.
Yeah. Hello. Yeah, I would like to invite panelists and organizers to have a group photo here. Aita. Aita. Ask Fabian to come. Yeah. Aita. Yeah. You can invite Fabian for photo. Your photo here. Yeah. Okay, you can take a photo. Yeah. Fabian. Yeah. Where's kick room? He left already. Okay. Yeah. Yeah. Okay. Ita, you join and Fabian. Yes. So we have. Yeah. No, here. You need to be here.
Yes,
Yeah,
yes,
Fabian, where's Fabian?
Fabian. Let me grab him.
Okay, panelists and organizers need to have a photo for the